today I'm going to talk about icing and how much should we be icing, how often should we be icing, especially early on, especially for those just coming out of surgery or about to have surgery. So icing is a topic that has been talked about historically, not only after acute injuries, but also after surgeries. Everybody knows the acronym RICE: rest, ice, compression, elevation, and this has been used widely for years and years and years in the sports and orthopedic world. We don't necessarily want to use ice for swelling purposes. Use ice for purposes of pain. In addition to the pain medication, icing can help be an adjunct or an assist. You could do it once per day. You could do it throughout the day if you'd like. Really depends on you, but do it for the reason of pain control. Now, when we ice too much and we constrict too much, we may not be decreasing swelling as far as the evidence suggests, but what we are decreasing is blood flow to that area. That's not necessarily a great thing either. So we don't want to be icing around the clock in numerous amounts per day. First response to healing is inflammation. So we want nutrients sent there. Just want to be able to circulate it up and out of the leg so we can get new blood in and take old blood out. Hope that makes sense there and clarifies, especially for those of you guys are prepping for surgery or just maybe had an injury and want to know about ice control and our stance to that.